Welcome to Hero's Journey Physio Fitness. Our mission is to empower, inspire, and mentor people to reclaim their health and become self-reliant in their fitness. I'm your host, Dr. Cameron Hogue. Join with me as my co-host, Annabelle Rios.
All right, Doc, you know what time it is. We're going live in 3, 2, 1.
Welcome, everybody. Annabelle, I think you got some exciting news to share that we never say on any of our podcasts.
This is the first time you're hearing it, guys. Subscribe to the podcast. Share the podcast. Rate the podcast. Love the podcast.
I feel like we should have been telling people this like the whole time, you know?
Yeah, I know. They don't know about it, but now they do.
All right. What are we talking about today, Annabelle?
We're busting some more myths over here, guys. Today's myth is don't lift more than 10 pounds.
Yes. So this one might not be as much of like a fitness myth, if you know what I'm saying. Like in terms of
Something
like,
that you see, right?
yeah, like this is something more that maybe in terms of healthcare or more that side of things, you might be hearing more of like, don't lift more than 10 pounds. You might not hear that like actually at the gym. Does that make sense? Like this is,
yeah. Because it applies to something, and we'll get into more of that here in a moment.
Yeah. So this, if you haven't heard this one before, you know, you might, hopefully never hear this from your doctor, but you might. And I do want to have a little disclaimer before we actually get into some content here. Okay. So number one, now and forever, we are not responsible for your choices or actions. Okay.
You're grown-ups here.
You're grown-ups. And if you're not a grown-up, I'm still not responsible for you. So whatever you choose to do, it is not on us. Okay. Always consult with your MD or your medical doctor, your PCP, whoever's in charge of your health. Always consult with them. Second, I am not trying to undermine any MDs out there, your own including, or their authority. Okay. I'm just giving my experience, and I'm backing it up with some research.
That's a DPT. He still has a D in there, guys. So you can listen to him. He's a doctor.
A little D, not a big D. So we're going to bust some myths about don't lift more than 10 pounds because I hear this a lot in the clinic. And yeah, let's just dive on in because there's some interesting stuff here. And side note, both Annabelle and I have sinus infections right now. So if we sound, you know, maybe raspier than usual.
You're welcome.
You're welcome. Don't get too turned on. All right. So
the history.
All right. The history here. So I scoured, and maybe, you know, if any of you viewers out there can find it, please let us know here. I couldn't find any source or origin on where this magical number of 10 and 10 pounds came from that you hear when doctors say don't lift more than 10 pounds. Couldn't find it. Not sure where it came from. So if anyone out there does have a source or origin of where it started, let us know.
Yeah.
We'd love to know. But Annabelle and I have some thoughts on where this came from. Okay?
A long, long time ago. Many moons.
In a galaxy far, far away. One thing that we're kind of thinking of is, well, you know, no one knows the exact weight that will tear or rupture, you know, a suture or an incision. And we're talking more of like post-surgical here.
Yeah.
So no one knows that exact weight. So it was probably like just agreed upon like, well, 10 pounds isn't going to hurt anything. So let's just tell people that like it's a conservative number.
Yeah, it was like a catch-all for everyone.
Yeah. So, you know, because again, no one really knows that number because no one really wants to know. Like, I know I just sewed you up, but now let's put some weight on there and see what's going to tear that open. So I think 10 pounds was kind of like, yeah, it's not going to hurt anything because it does range. I've heard 8, I've heard up to 15, but 10 is always kind of that go-to number. So I think it's number one, it's safe, conservative.
Yeah.
Another thing I think, and this is this is just kind of funny. I think some people just need to be told what to do or they won't do it.
Yeah. Especially after like a procedure that they just had done.
Yeah. Sometimes just giving somebody a hard, fast number. People just need to be told what to do.
Instead of like, you figure it out.
Yeah.
Like, what?
And so yeah, I think that's another reason kind of where this might have come from. And here's a big one. I think this third one is probably, I don't know if it's the most important, but it could be the most important to the MD, is litigation. You know?
Dun, dun, dun.
Do you want, I pulled up the number here, and I forgot the year that this was, so it might be more now. It probably is more now. Do you want to know what the medical liability system cost in the U.S. last year?
Tell me.
If you had to guess, what do you think?
It's probably at least in the millions.
It was $55 billion annually.
Oh, it's a B.
With a B.
Oof.
Billion. $55 billion was the cost for medical liability insurance and all that kind of stuff. So I think we don't even need to go down the rabbit hole of people being sue happy and, you know, all that kind of stuff. I don't want to talk about that. But I think another thing is, hey, if I tell people 10 pounds and we know it's pretty conservative and I know they're going to probably listen to it, it's probably going to save our butts.
Yeah.
So there's probably some background to all this.
And they typically tell you not to lift 10 pounds, for like 2-3 weeks?
Surgery? Well, depending on what it is, it could be like 4 to 6.
Okay.
So I think, so we're about to talk about surgical and non-surgical. So, and we at the very end of the podcast, we have some recommendations. That way, if you stay tuned to the end, we give you some pretty good recommendations to follow. Again, remember the disclaimer I said. So I think some of these things isn't the worst thing in the world for people who just had surgery. Because again, they need to be told what to do. We don't want to rupture anything, but I think some of the time that mindset, that 10 pounds then becomes like a way that even after their tissue is healed is kind of what's in the back of their mind. And so that's one thing that I kind of want to break to today is if you're on the surgical side of things, we're going to talk about tissue healing and things that you can expect after your tissue is healed and all that kind of stuff.
You don't want to be afraid of a 10-pound dumbbell.
Yeah.
You know?
You don't want to be afraid of a 10-pound dumbbell. That's right, Annabelle.
It's like, what if it's just like walking around your house and
hiding in the bathroom?
Yeah.
Okay, so let's talk about non-surgical first, okay? So we just talked about some of those things, and those really more apply to surgical. If we're talking about non-surgical, meaning like maybe you just you hurt your shoulder, you're in some pain, or you hurt your back. And again, previous podcast, we talked about injury is not the same thing. Doesn't always have to be the same thing as pain, and pain doesn't have to always be the same thing as injury. So let's just say you have pain in your low back. You go to the doctor, and they're like, hey, don't lift more than 10 pounds. Okay, this is pretty much BS. I know. If you are non-surgical, don't lift more than 10 pounds is pretty much bullcrap.
Why?
And here's why. So you know that old saying, I don't even know if it's an old saying. It's a saying that I've said, I don't know where I got it from, that you can't go wrong getting strong. Have you heard that before?
Oh, no, but I like that one.
Yeah, so a lot of times in physical therapy, I'll tell my patients like, hey, we need the surrounding muscles around these joints. We need this area. We need to get it strong. And you can't go wrong getting strong. Like, it's going to just make everything better, and we're going to scale it. So how do we get strong, Annabelle?
Is this a Father Hogue exclusive?
No. How do you get strong?
Oh, no, I meant your comment that you made. I like that. You can't go wrong getting strong.
Yeah, but how do you get strong?
Progressive overload.
Okay. So how can you progress over 10 pounds if you're told not to lift more than 10 pounds?
It's very hard.
It's impossible. You can't. So why would we limit the amount of weight that should be lifted to get strong, to get out of pain, and to protect our joints and our back and whatever? That's crap.
I think you'd be misunderstanding in the way the muscles work.
Yeah. And I do want to give, some grace out there to some MDs if they have been saying this. Maybe they're saying it, but saying it with some stipulations, and all the patient heard maybe was don't lift more than 10 pounds. And it wasn't like, don't lift more than 10 pounds for a week. I don't know. Maybe there's some other things on there, but when patients come to us and they're like, my doctor said I can't lift more than 10 pounds. And I'm like,
but like, why did he or she initially say it? Because like, you're all right. There may have been a reason. Maybe it was don't lift more than 10 pounds until you can do X, Y, or Z, or
Yeah, maybe. Yeah,
maybe.
But that's not what we get when they come to us. And this is something else that we get too is I cannot tell you the amount of times I've heard this. My doctor said this is the worst x-ray I have ever seen. I've heard that from hundreds of patients. So how in the world can that be true if so many people are telling me?
If they're all terrible.
If they're all terrible, how can it be the worst? You know, someone's got to be second to worst at least. But what this does and why I'm passionately talking about this is because we get a lot of patients that come in that will say things like, it's bone on bone. It's the worst x-ray they've ever seen. They said I shouldn't lift more than 10 pounds. And again, we're talking non-surgical here. And what this leads to is a condition. It's called kinesiophobia, which is a fear of movements. Fear of movement or movements, whatever. So I pulled up a study here, and I'm just going to quote from the study because it was really good. So kinesiophobia, or this fear of movements, in which a patient has excessive, irrational, and debilitating fear of physical movement and activity resulting from a feeling of vulnerability to pain or re-injury. And what they also found is this leads to worsened disability and increasing pain sensation.
In a sense, you're teaching somebody to avoid something. There are, a lot of things weigh over 10 pounds. Let's say you have kids.
That's a great point, Annabelle.
It's going to weigh more than 10. Very quickly it's going to be weighing more than 10 pounds.
Exactly. This type of mentality, you're fearing the one thing that's going to help you. The movement is going to help you. The weight is going to help you. And what happens is we get so many people that come in and they're pretty much scared to move, and we have to start with just simple exercise. Like what these people are capable of is so much more, but we have to start from almost below zero. Like we just have to get them moving again. Like try and find some
like bands even lower than body weight.
Like I'm talking like gravity eliminated. Like
oh wow.
So like you can like lay on your side and move your. I can show you this later, but you can lay on your side and move your shoulder where gravity doesn't affect it as much as if you were standing. And even like stuff like that, we'll do gravity eliminated or like laying on your back just to introduce some movement. And this 100% leads to bad outcomes in terms of ever getting better. And like they said, worsen disability and increasing their sensation of pain.
Well, it's kind of why we wanted to do this series of myth busting is because they will shape the way you view health and fitness. And in this case, if you're avoiding 10 pounds, your body's going to naturally, it does already, but it's going to get weaker and weaker as the years go on.
I won't say any names or anything like that because of the HIPAA and everything, but we had a younger lady that was told she had a bulging disc and it was the worst they'd ever seen at this age, and that this person shouldn't lift weights or exercise again. And the crazy thing was the bulging disc was on the opposite side of her pain. So the bulging disc was on her right side and a few levels above, where her pain was on the left side, a few lower levels below. Like she wasn't even having pain where the disc was. Now, could there still be referral, potentially. But the odds of that bulging disc actually causing her pain was actually probably lower. There's probably other things going on, but it took a lot to get her moving again and eventually like lifting.
Honestly, you're not even doing physical work. You're doing a lot of mental work with her too.
A lot of times it's positive reinforcement. Like
changing the mindset of how to view that.
Exactly. Because what kinesiophobia leads to, other than worse outcomes and disability and pain, it can lead to what's called pain catastrophizing. Okay, so this can be a vicious cycle. So again, I'm going to just quote from another study that researched and talked about pain catastrophizing. This is characterized by the tendency to magnify the threat value of a pain stimulus and to feel helpless in the presence of pain, as well as by a relative inability to prevent or inhibit pain-related thoughts and in anticipation of, during, or following a painful event. Okay, so there are 3 things that was said there. Number 1, they start to magnify their pain. Okay, so you'll hear things like, I'm afraid that something serious might happen, or something worse might happen, or I might re-injure myself, and that pain starts to magnify, it starts to grow. People then start to ruminate about their pain. I can't stop thinking about how much it hurts, like how much it's affecting me doing this and how much it's affecting me doing that, which then leads to the 3rd thing, the feeling of helplessness. There's nothing I can do to reduce the intensity of my pain. So when we get patients that come in that have kinesiophobia and their pain catastrophizing, it is really hard to get them better, even if it's a simple musculoskeletal injury, because now we got the mind involved, we got the nerves involved. It's more than just like a stimulus, some sort of maybe like biomechanical damage or something. Now we got all systems on board, and it's really hard to get good outcomes when you have these type of things going on.
No, it just makes me think about how we're always trying to empower people and show them really what's going on. The mind's, I love a lot of the mind psychology because it really impacts everything else.
It does.
And to your point, you are blowing things in your mind. So it's like you're weighing the risk and reward, and you're like, oh, well, I don't even want to start lifting because it's going to make my back pain 10 times worse. It's going to make X 10 times worse. Even though you're not really looking at the opposite side. Okay, well, let's play this out. Let's say I don't lift anything past these 10 pounds for the rest of my life. Because you can go down there, right? You see these 2 paths. But you mostly just play out the one on the right, even though you don't really understand it all.
Right.
You feel like you understand the one on the left, which is don't lift more than 10 pounds.
Yeah.
Even though that's the one that's most likely going to lead you to way worse results.
Exactly.
In the long run.
Definitely not getting better.
Yeah, you're not going to get better.
So I think one of the biggest things that we're trying to like bust the myth here is that we don't want to become fearful of movement. We actually want to learn to enjoy movement and start to see exercise as medicine. That movement is medicine, and that is, and that if we can get our minds around that, it can help to like decrease, like where we're not magnifying our pain, we're not thinking about our pain, we don't feel helpless about our pain.
It's helping you, not hurting you. And yes, we're not saying go out there and lift excessive amount of weight. You need to know yourself, where you're at that moment, and then slowly progress.
Stay tuned to the end. We'll give you some recommendations on what to do for non-surgical pain if you don't need to, if they're told not to lift more than 10 pounds, what should you do? Okay, now the surgical. Okay, this is the one where, again, I just want to tell you about tissue healing, okay? Because with surgical, they have obviously repaired something. They've had to most likely open up your body, skin. So even though they're getting better at, not having to leave as big of incisions and all that stuff because of all the computers and machines and all that kind of stuff. But I want to tell you about normal tissue healing, okay? Those are with people with minimal to no comorbidities, okay? So if you're a smoker, you have diabetes, stuff like that, it's going to 2 to 3 times your tissue healing. So it'll take longer to heal. So we don't want that. Okay. So if we're looking at tendon, okay, so a tendon rupture, there's different grades. Sometimes that needs surgery. The average time you can expect to heal is 6 months, okay, for full tissue healing. Now, within about 5 to 6 weeks, like after that tendon has been ruptured and you've had surgery, you'll be able to actually start loading that tendon again. Within that first 5 to 6 weeks, that's where you want to lay low. You'll probably be in a sling, stuff like that, where you're not using it very much or letting things heal. But after that 6 week mark, then you can able to load that tendon. And then from about week 6 to about 6 months, you are slowly loading the tendon so that it heals properly. But within 6 months, that tendon's good to go. That is the normal tissue healing from somewhere about 6 weeks to 6 months. That tendon will be good to go.
So after the first 6 weeks, you're kind of just recovering. After that, you can slowly start integrating into more movement.
Yes. Now, again, it also depends on the tendon. When I was thinking of that, I was thinking of like the rotator cuff, like in the shoulder.
Mm-hmm.
But if it's like your quad or patellar tendon, which is down in the leg, that might take a little bit longer and slower loading because it's more of a weight-bearing muscle because obviously you're on your legs versus being on your arms. Usually doctors have protocols for that. But what I'm saying with this is if you know the tissue healing for tendons, you can start to feel more comfortable. You can start to feel a little bit more safe that tendon's going to hold, and we're just going to slowly kind of load the tendon until we get back to normal. Things like muscle. So let's say some sort of grade. So there's different grades, like 1, 2, and 3 grades. Let's go with the worst grade. Grade 3 is the worst type of...
is that a full muscle tear?
Full muscle tear.
Mm-hmm.
Again, it's going to be about the same as a tendon, about 6 weeks to 6 months for it to be fully healed. Now, if it's like a lower grade, what we saw like a pull muscle, like a grade 1 is like you pulled your hamstring, you pulled your quad, that's a grade 1 tear. About a month you'll be 100% ready to go, but you could be feeling better within a week or 2. So just knowing these type of things, and then of course things like bone, you're looking at about 2 to 3 months, at least a month or 2 in a cast, and about another month for it to be kind of fully back to normal. But guys, your tissue is going to heal. Okay, your tissue is going to heal, especially if you're, again, normal healing. For a normal person, it's going to heal. Ligament takes a little bit longer. That can take up to the year plus. But those are some, we can post this chart maybe in the show notes.
Yeah.
That way people can kind of take a look and just kind of see.
That the body was made to heal.
The body was made to heal.
It's beautiful.
Very beautiful. Okay, so we got some recommendations. So surgical recommendations, since we're just talking about that. If you're surgical, my advice, recommendations is follow your MD's precautions. Okay. But just know that the lifting restrictions are very conservative. Make sure you understand tissue healing. Look at that chart. And maybe a better limit would be is don't lift anything that feels too heavy. Don't lift anything that feels heavy.
Yeah.
I mean, if your kid doesn't feel heavy, it's probably not gonna hurt it. I know, again, listen to your MD's advice, but I'm just saying I'm trying to give us more of a resilient mind.
Mm-hmm.
Our bodies aren't fragile. Our bodies are more resilient. So that would be my recommendations is just know they're conservative. Don't lift anything that feels too heavy, and know your tissue healing. So talk to your doctor about that. Talk to your physical therapist. Look at this chart. Message us. Whatever. Number 2 is, again, allow for that proper tissue healing, like we talked about. And then once proper tissue healing has occurred, follow the rules of progressive overload. Start light and start building up. It's a tendon. It's going to heal. It's a bone. It's going to heal. It's a muscle. It's going to heal. Once you know you're in that safe spot to start loading, progressive overload. Start loading that tendon up. I literally had a 19-year-old female with an ACL tear. She was deadlifting her body weight by, when was that? It was about 6 to 8 weeks maybe after her surgery.
Wow.
So, because at the 3-month mark, over 2 months, you're wanting to get a little bit more into some, dynamic kind of stuff. But yeah, I said you can't do that until you can deadlift your body weight. She deadlifted her body weight. We built up progressive overload.
It works.
It works. Okay, so non-surgical injuries. You guys remember episode 7? What was that episode, Annabelle?
It's one of our favorite ones. Peace, love, and thunder.
Peace, love, and thunder. If you are non-surgical, throw that crap out the window. It's not the worst x-ray they've ever seen. Lift more than 10 pounds. Follow the advice of Peace, Love, and Thunder. Episode 7. Go check it out.
We'll put it in the show notes.
And then check out your local physical therapist too. Don't sleep on your local physical therapist.
Don't sleep on the DPTs.
That's right. And if you're in Chattanooga, come see me. I feel like a car salesman. Don't you leave until you see me. But yeah.
We're just trying to reshape your mind around all of this. And honestly, start your journey. Don't be afraid. It's actually going to help you in the long run.
That's a good point, Annabelle, because a lot of people want to get started on their journey after a surgery. They're like, man, I realize I need to really get back in shape, but I've had the surgery, so I can't. Guys, you can. Things are going to heal progressively. Overload, it's going to get back to normal.
Yeah.
So your body's not fragile. You got anything else, Annabelle?
That's all I got, Doc.
Okay. Well, guys, remember that you are human. We should not seek perfection, but daily improvement. We'll see you guys later.
See you guys.